Hello, Dr. Vicki Peterson here. I wanted to speak with you today about Domino's Pizza, of all topics. If you follow everything gluten-free, you may have already heard that Domino's Pizza last month, May 2012, came out with a personalized pizza. And for those who enjoy pizza, this was pretty exciting, but it wasn't too much longer until the company then said, you know, we cannot confirm that cross-contamination isn't occurring in our kitchens. So the pizza would, I guess, arrive individually packaged, but then once they took it out, you know, you just imagine what you think about when you think of people making pizza. You know, they're throwing it up in the air and there's flour flying. So of course cross-contamination is going to occur, and basically what Domino's came out saying is that we cannot confirm that cross-contamination is not occurring, and that these pizzas are only for people who are mildly gluten sensitive and definitely not for celiacs. Yeah, it brings up a few interesting points. So one is if you get some cross-contamination and you don't react knowingly, meaning, you know, you don't feel something occurring in your body, does that mean your immune system on a deeper level is not reacting? Fortunately, a new test has come out that is looking at autoimmune reactions, meaning what your immune system is actually doing as far as any ingestion of gluten, which we know it doesn't take much for that immune system to then get revved up and possibly start attacking other parts of your body, which is what happens in autoimmune disease. So I don't have a definitive answer for you on this, but I do, based on 20 some odd years of clinical experience, feel strongly about the fact that I don't know a lot of people who, whether they're celiac or gluten sensitive, don't get affected negatively by ingesting gluten. Now, whether it's a trace amount, you know, I mean, I have patients who start out with us so sensitive that if they walk by a place in the mall that's making pretzels, that's enough to set them off. Obviously, there's some work to do with their immune system, and usually when we get them healthier, they no longer have that problem. They can walk by and not have a reaction. That's a lot different than someone putting croutons on your salad and then going oops and taking them off, but there's still some actual remnants physically there of that crouton. So this is what was likely happening with the Domino's, especially their pizza ovens. They certainly didn't have a delegated pizza oven that was only used by gluten-free pizzas. So point number one, I don't think that somebody called it recently gluten light, and as a sort of a new title for gluten sensitivity, meaning, you know, you only had to be sort of careful. I don't agree with that, and I think we're going to find that that's a dangerous precedent to maybe take. But the other point I wanted to make is that I learned something with this experience, and that was that hearing that Domino's, a nationwide chain, not new to the business, came out with a gluten-free product. I don't eat fast food and I don't eat dairy products, and so, you know, it wasn't something I was going to ingest. But when I heard about it, I wasn't really worried about cross-contamination. I felt that if a national chain was publicizing that they had a gluten-free pizza, that they had done their due diligence, they knew what it meant to offer a gluten-free product, and it was safe. That was my assumption, and I was completely wrong. So it leads to the point of what do you do when you go out? What do you do when you go to a bakery and you say, I mean, I've done this. I've gone to a bakery with my children and said, do you have anything that's gluten-free? And sometimes they point to their, you know, macaroons or there's little almond horns sometimes that are made just with marzipan and sugar and egg whites, and they're told, you know, we're told they're gluten-free, and I've given those to my children. So, but the question is, what are your practices? You know, are these made at the very same time that you're making all those gluten-containing goodies? If so, there's way too much cross-contamination for that person to be able to call that gluten-free. And so I've run across this recently with a patient who started a bakery and decided to offer gluten-free bread and other goodies, only to find out they were not making really any attempt to prevent cross-contamination. So we really need to ask that question. Obviously, when you're in your own kitchen, you're safe, you know what's occurring. But when you go out, just because the finished meal has no ingredients that contain gluten, you have to ask that next question to really be safe. So I'm not trying to put down Domino's, certainly, and hopefully they'll make that extra effort. I recently heard of Chuck E. Cheese, which not exactly a health food destination either, but they came out with an individual pizza that comes frozen, wrapped. They actually cook it in the wrapper, so I'm not sure what kind of wrapper, but they cook it in the wrapper, and then it comes to your table with its own individual pizza cutter. Now, somebody was thinking on that one. So that's more what we're looking for, is because when they've done those actions, then they're happy to say they've done them. Yep, this is your own pizza cutter, nobody's touched it, it was wrapped the entire time, then you know you're safe. So anyway, I hope this was helpful, just some practical advice to think about when you're eating out. And let me know your experiences in this department and any questions you have. I love to hear from you all. And until next time, I wish you very good health.